Hey everyone, welcome back for another deep dive into the fascinating world of microbes.
Glad to be back.
Today we're tackling a topic I'm sure you're all familiar with, wound and bite-related infections.
Yep. Those pesky little invaders.
And to guide our exploration, we're turning to the World Health Organization's Aware book, specifically Chapter 18.
So access, watch, reserve, great resource.
It really is. Now, for this deep dive, we're focusing on those milder cases.
The ones we see day in and day out.
Exactly. So picture this. You're in the lab, analyzing samples, advising clinicians.
Trying to stay one step ahead of those microbes.
Always. So how do you approach a potential wound infection? What are those initial red flags that catch your eye?
Well, first we need to think about what we're dealing with. What exactly constitutes a skin wound?
Good point. It's easy to take that term for granted.
Right. So the WHO defines it pretty broadly as any break in the skin, from scrapes and abrasions to deeper punctures.
So that break in our protective barrier, that's what sets the stage.
Exactly. And it's that open door that invites all sorts of microbial mischief.
Speaking of mischief, what are some of the telltale signs that a wound is heading south?
Well, the early signs can be pretty subtle.
I bet redness, a little swelling, maybe some warmth around the wound.
Exactly. Those are our usual suspects, but they're not always a cause for alarm.
Right, because inflammation is a natural part of the healing process. So when do we start to worry?
It's all about looking for that shift from a superficial, localized infection to something more invasive.
Invasive, okay. What does that look like clinically?
So think about the color changes around the wound. Is it getting darker, taking on an unhealthy hue?
Like a purplish red instead of a bright pink.
Yeah, and is the swelling spreading beyond that initial injury site?
Those are good visual cues.
And of course, any signs of systemic infection like fever, chills, or swollen lymph nodes, those should send alarm bells ringing.
So it's all about recognizing those subtle but important changes. Now, let's say we have a patient with a wound that's showing some early signs of infection. What's our next move in the lab? Full battery of tests.
Well, that's where the WHO guidelines get interesting.
Oh, how so?
They actually advise against routine microbiological testing in mild, uncomplicated cases.
Wait, really? But aren't we always taught to identify the culprit before starting treatment?
Traditionally, yes, but there's a growing recognition that over-testing can lead to unnecessary antibiotic use.
And we all know where that road leads.
Straight to antimicrobial resistance. Plus, it doesn't always change our management approach in these milder cases.
So we're taking a more targeted approach, relying on clinical judgment and good old-fashioned observation.
Exactly. But let's say we do decide to investigate. What are we likely to find in these wound infections? One lone wolf or a whole gang of microbes?
The microbial party.
You got it. Wound infections are often polymicrobial, meaning we're dealing with a mix of different bacterial species.
Makes sense. It's a crowded space.
So who are the usual suspects at this party?
Well, I'm guessing Staph aureus is always a top contender.
You know it. Especially those pesky MRSA strains. And Streptococcus species are usually hanging around too.
Lurking in the shadows. What about those anaerobic bacteria? They love those oxygen-poor environments.
Right, especially in deeper wounds or bites.
Speaking of bites, those always seem to add another layer of complexity.
They do. The type of bite can really influence our microbial lineup.
I can imagine. So let's take a look at Table 18.2 from the WHO guidelines. They've got some intriguing examples.
Right, like cat bites, notorious for causing deep puncture wounds.
Those sneaky felines, what's the main concern there?
Well, those deep punctures introduce bacteria right into the tissues, increasing the risk of infection.
Okay, so what bacteria are we worried about specifically?
Pasteurella multisida is a big one. It can cause a rapidly progressive cellulitis.
Ouch. I'll be extra careful around my cat from now on.
Good idea. Now, what about man's best friend? Dog bites. Are those just as risky?
I would think so. Dogs have a lot of bacteria in their mouths.
True, but they tend to have a slightly different microbial profile.
Interesting. So what are we looking for with dog bites?
Well, we might still see Pasteurella species, but Capnocytophaga canamorsis is a particular concern.
Whoa, that's a mouthful.
It is, and it can cause severe infections, especially in people with weakened immune systems.
Okay, so we've got cats and dogs covered. What about something a little less domesticated? Rodent bites.
Rodent bites. Those can be nasty. Both the physical injury and the potential for infection.
I bet. So what are the culprits there?
Two main ones to watch out for: Streptobacillus moniliformis and Spirillum minus.
Those sound familiar. Aren't those the bacteria behind rat bite fever?
You got it. And despite the name, it's not just a historical curiosity. We still see cases today.
Wow, that's a blast from the past. Okay, so we've covered the usual bacterial suspects, but are there any other microbial villains we need to be wary of?
Well, there are always a few unexpected guests. We need to be mindful of those anaerobic bacteria.
Especially in deeper wounds.
Right, or those contaminated with soil or foreign material.
Like a microbial buffet down there.
And let's not forget about Clostridium tetani.
The tetanus culprit. A good reminder that vaccination is key.
Absolutely. Okay, so we've explored the clinical signs and the microbial landscape. What about other lab tests?
Yeah. Do we need to order blood work or imaging in these milder cases?
The WHO guidelines are pretty clear on that.
Oh, fill us in.
They say routine blood tests like a CBC or inflammatory markers aren't usually necessary in these straightforward cases.
So we're focusing on that clinical assessment.
Right, and reserving those tests for patients with signs of systemic infection or those not responding to treatment.
Makes sense. We want to use our resources wisely. Now, what about imaging? When do we need to see what's happening beneath the surface?
Imaging like an X-ray or ultrasound is usually reserved for suspected complications.
Like an abscess.
Exactly. Or if we think the infection is spreading into deeper tissues.
We don't want any surprises lurking down there. Okay, so our patient comes in with a wound. We've assessed the situation. What are those immediate steps we take to prevent infection from taking hold?
Well, thorough cleaning and debridement are our frontline defenses.
Good old-fashioned soap and water. Right.
Exactly. It might seem basic, but it's absolutely crucial in reducing the bacterial load and promoting healing.
You know, sometimes the simplest solutions are the best.
Agreed. Cleaning involves gently washing the wound with mild soap and water, removing any visible debris.
So getting rid of all that dirt and grime.
And irrigation with saline can be helpful too, especially for deeper wounds.
And what about debridement? What does that entail?
It involves removing any dead or damaged tissue.
So creating a clean slate for new tissue to grow.
Exactly. It reduces the bacterial load. A&D sets the stage for optimal healing.
Like giving those healthy cells a fighting chance. Okay, so now let's talk antibiotics. Are they always necessary for wounds?
That's a great question, and I think there's a lot of misconception out there.
Yeah, it seems like people think antibiotics are the answer to everything.
But the WHO guidelines are very clear. We need to be judicious.
Judicious meaning?
Meaning we use antibiotics only when they're truly needed. Overuse only fuels the fire of antimicrobial resistance.
And that's a fire we definitely don't want to fan.
So when, Dia, we reach for those antibiotics, when are they warranted?
Yeah, what are the specific situations?
Well, Table 18.4 in the guidelines is our roadmap. Firstly, if there are obvious signs of infection, increasing redness, warmth, swelling, pain, especially pus.
Okay, so those are clear indicators.
Right. Then there are bite wounds, as we discussed. They carry a higher risk of infection.
Because of the nature of the injury and those potential pathogens.
Exactly. Location also matters. Wounds on the face, hands, near joints. Those are considered high risk.
Because they can spread more easily.
And of course, we always consider the patient's overall health.
Right. Someone with a weakened immune system might need antibiotics even for a minor wound.
It's all about preventing things from spiraling out of control.
So it's not a one-size-fits-all approach. We need to think critically about each case.
Absolutely. Now, let's say we've decided antibiotics are necessary. What are our options?
What are our go-to choices for these milder wound and bite infections?
Well, Table 18.4 outlines some specific choices for both adults and children.
Along with dosages and durations of treatment. Okay, so walk us through it.
For many uncomplicated skin infections, oral antibiotics are sufficient.
Easy peasy. What's a good option?
Amoxicillin clavulanate is often a good choice.
The classic combo. Why is that a good pick?
Well, especially for bite wounds, it has broad coverage against both aerobic and anaerobic bacteria.
We're covering all our bases.
Now, if we suspect staph, aureus, cloxacillin, or cephalexin are good alternatives.
And what about those MRSA cases?
Doxycycline or trimethoprim sulfamethoxazole can be used there.
Lots of options to choose from. But I'm sensing a theme here.
And what's that?
It's not just about picking any antibiotic. It's about choosing the right antibiotic for the job.
You nailed it. This is where antimicrobial stewardship comes into play.
Gotta love that stewardship. It's about being responsible prescribers.
And making sure we're using these valuable drugs wisely.
Okay, now let's step back for a moment. How do these wound infections actually develop? What's happening at the cellular level?
Imagine this. You have a break in the skin,
A microscopic gateway.
And those bacteria, whether they're already on the skin or introduced through a bite, see this as an open invitation.
Like a welcome mat.
They enter, multiply, and if conditions are right, boom, infection.
It's a microbial invasion.
Our immune system tries to fight back, which leads to that inflammation we talked about.
It's a battle raging beneath the surface.
Exactly. And that's why cleaning and debridement are so crucial. We're disrupting that battlefield.
Making it harder for those microbial armies to set up camp.
Now let's zoom out a bit.
Well,
talk about the bigger picture. How common are these wound and bite infections?
Yeah, are there any global trends we should be aware of?
The WHO's got some insights on that. Road traffic injuries are a major cause of wounds.
Not surprising, I guess. Especially in areas with limited access to medical care.
Right. And then there are animal bites.
Always a concern, especially for kids.
And guess who's the most frequent offender?
I'm going to guess dogs.
You got it. Man's best friend can sometimes be a bitey friend, but there's a serious concern linked to these bites.
I'm guessing you're talking about rabies.
A major issue in areas without widespread animal vaccination. Okay, so before we wrap up this part of our deep dive...
I think it's time to put your knowledge to the test.
Oh, you're going to quiz me.
5 exam-style questions. Ready?
Bring it on.
Okay, question number 1. A patient presents with a dog bite on their hand.
Okay, dog bite, hand.
What's the preferred first-line antibiotic treatment? Think carefully.
Given the location and the risk of both aerobic and anaerobic infection, I'd go with amoxicillin clavulanate.
Excellent. You're off to a great start.
Ew.
Okay, question 2. True or false? All wounds require antibiotic treatment.
False. We talked about judicious use, right? Many wounds can heal just fine with proper cleaning and care.
2 for 2. You're on a roll. Question 3. What are the 2 most important initial steps in managing a wound to prevent infection?
Thorough cleaning with soap and water and debridement, those are key to removing bacteria and creating a clean, healing environment.
You're a wound care pro. Okay, question 4. What's the key distinction between superficial and invasive wound infections?
Superficial infections stay put, while invasive infections spread beyond the initial wound site, potentially causing complications.
All about that depth and spread.
Exactly. And looking for those signs of systemic involvement.
Okay, last but not least, question 5. Besides bacteria, what other types of pathogens can be transmitted through bites?
Ooh, tricky. Bites can transmit viruses like rabies, hepatitis B and C, even HIV, and we can't forget about parasites.
You aced it. You're officially a wound and bite infection expert.
All thanks to those WHO guidelines and this deep dive.
Exactly. So tell me, before we move on, is there anything about this topic that you find particularly challenging or surprising?
You know, it's always a challenge to strike that balance between being a responsible steward of antibiotics and not missing a potentially serious infection.
Yeah, it's a delicate dance.
We have to trust our clinical judgment, but also be ready to pivot if things aren't adding up.
Makes sense. And it highlights the importance of staying informed about the latest research and guidelines.
Absolutely. Because those microbes, they're constantly evolving, always finding new ways to challenge us.
And that's what keeps things interesting.
You know it.
Well, I think we've covered a lot of ground in this first part of our deep dive. We talked about definitions, clinical presentations, the microbial landscape, and even touched on some global trends.
And we even squeezed in a little quiz.
Always got to test that knowledge. But there's still much more to explore.
Like what?
Well, we've talked a lot about bacteria, but what about those other pathogens that can complicate the picture? Fungi, parasites, viruses.
We can't forget about those.
And I'm also curious to hear about some of your most challenging or memorable cases.
Ooh, I've got a few stories to tell.
So stay tuned for part 2 of our deep dive into wound and bite infections. We'll be back after a short break.
See you soon. It is a delicate dance, isn't it?
It is. And it makes you realize that even those seemingly straightforward infections can have hidden depths.
You know, it's like we're constantly trying to stay one step ahead, anticipating those microbial curveballs.
Speaking of curveballs, we've talked a lot about bacteria, but what about those other pathogens that can complicate the picture?
Yes, we can't forget about those. Fungi, parasites, viruses.
They can definitely throw a wrench in the works.
So let's start with fungi. While they're less common than bacteria in wound infections, they can certainly occur.
Especially in certain patients, right?
Right. Those with compromised immune systems or underlying medical conditions like diabetes.
So what should we be on the lookout for? What are those telltale signs that a fungus might be involved?
Well, persistent redness and itching are two key things. And keep an eye out for those satellite lesions.
Satellite lesions, those little bumps or blisters that pop up around the main wound.
Exactly. Those can be a clue that a fungus is spreading.
Okay, so fungi check. What about parasites? I'm guessing those are more of a concern with bite wounds.
You got it. We can't forget about those pesky mosquitoes and ticks,
They can transmit a whole host of nasty things.
like malaria, Lyme disease, Rocky Mountain spotted fever.
Yikes. Those are some serious infections.
So a thorough travel history is crucial when assessing those bite wounds.
And knowing the local epidemiology, we need to be aware of what's circulating in the area.
Absolutely. Now, let's move on to viruses. Besides rabies, are there any other viral threats we need to keep in mind?
I'm all ears.
Well, viral infections in wounds are less common than bacterial or fungal infections.
Okay, but they can still happen.
Right. Herpes simplex virus, for example, can sometimes cause skin lesions that might be mistaken for other types of wounds.
So it's about keeping a broad differential.
And in healthcare settings, we need to be extra vigilant about the potential for bloodborne viruses.
Like hepatitis B and C and HIV.
Exactly. Those can be transmitted through needle stick injuries.
A good reminder to always follow those safety protocols.
Always. Now, I'm curious to hear about your experiences. Have you encountered any particularly challenging or memorable cases involving wound or bite infections?
Well, one case that really stands out involved a young boy who came in with a cat bite. The initial wound looked pretty minor, but within a few days, he developed this rapidly progressive cellulitis.
Oh, wow. That's concerning.
It was. The infection spread up his arm like wildfire, and he was in a lot of pain.
What did you do?
We started him on IV antibiotics right away, but his condition kept deteriorating. High fevers, chills, his arm became extremely swollen.
Sounds like it could have been necrotizing fasciitis.
That was our fear. We were really worried. So we consulted with the infectious disease team and decided to do a surgical debridement.
To remove any infected tissue.
Exactly. And thankfully, the cultures grew Pastorella multicida, which was sensitive to the antibiotics he was already on.
That's a relief. So he responded to treatment.
He did. Slowly but surely. It was a long road to recovery, but he eventually made a full recovery.
Wow, that's a great reminder that even those seemingly minor wounds can pack a serious punch.
It really is. And it highlights the importance of teamwork and quick thinking.
Absolutely. We need to be able to recognize those red flags and act fast.
And we can't forget about the importance of communication and collaboration between different healthcare professionals.
From the nurses and doctors to the pharmacists and lab techs, we're all in this together.
And of course, we can't forget about our fellow microbiologists, the unsung heroes behind the scenes.
Working tirelessly to identify those microbial culprits and guide those treatment decisions.
Absolutely. Now, before we wrap up, I have one last question for you. If you could give one piece of advice to our listeners, fellow microbiologists working in this field, what would it be?
That's a tough one. But I think the most important thing is to never stop learning. Microbiology is a constantly evolving field.
It certainly is.
There's always something new to discover, so stay curious. Read the latest research, attend conferences, connect with your colleagues.
It's all about staying ahead of the curve, right?
Exactly. The more we learn, the better equipped we'll be to face those microbial challenges head on.
And that's what makes working in medical microbiology so exciting. We're constantly pushing the boundaries of knowledge.
It's like we're explorers, venturing into uncharted territory, mapping new pathways, discovering hidden connections.
Who knows what amazing new microbes are waiting to be discovered? Maybe someday we'll even harness their power to develop new treatments.
Now that would be incredible.
It really would. Well, I think we've covered just about everything there is to know about wound and bite infections.
From the common culprits to the rare and unexpected. We've talked about antibiotic stewardship, the impact of climate change, and even shared some personal experiences.
It's been a truly fascinating deep dive.
It has, and it's a reminder that we're all part of a larger community working together to understand and combat these infections.
To all of our fellow microbiologists out there, thank you for joining us on this journey. We hope you've learned something new and maybe even gained a fresh perspective.
And remember, never underestimate the power of those tiny microbes. They might be small, but they can certainly pack a punch.
Until next time, stay curious, stay informed, and stay healthy.
And keep exploring that fascinating world of microbes. There's always more to discover.
I love that. Microbial explorers. It's like we're on a constant quest to unravel their secrets.
Unraveling those secrets one microbe at a time.
Exactly. And you never know what you might find lurking around the corner.
Who knows? Maybe we'll stumble upon the next big breakthrough in medicine.
Maybe we'll find a microbe that can solve the plastic pollution problem.
Or one that can help us combat climate change.
The possibilities are endless. It really makes you appreciate the incredible diversity and power of these tiny organisms.
They might be small, but they can certainly make a big impact, that's for sure.
They really can. Well, I think we've covered a lot of ground in this deep dive into wound and bite infections.
We've gone from the basics to some pretty complex concepts.
We have. We talked about the different types of wounds, those common bacterial culprits, the importance of those first-line defenses.
And we can't forget about those sneaky viruses, fungi, and parasites that can complicate things.
Oh, and those exam questions. I always enjoy a good quiz.
Me too. It's a fun way to test our knowledge and make sure we're all on the same page.
Speaking of being on the same page, I want to thank you for sharing your expertise with us today.
It's been a pleasure. I always enjoy talking shop with fellow microbe enthusiasts.
And to all of you listening out there, thank you for joining us on this deep dive into the world of wound and bite infections. We hope you found it informative and maybe even a little bit entertaining.
And if you're ever feeling stuck on a tricky case, remember those WHO guidelines. They're a great resource.
They really are. Well, that's all the time we have for today, but we'll be back soon with another deep dive into a new and exciting topic.
Until then, keep those microscopes humming and those minds curious.
And remember, the microbial world is full of wonders waiting to be discovered. So stay curious, stay informed, and stay healthy.
See you next time.